Hi, Dr. Rutherford here, and today we're going to be answering some questions. One of the questions, well, today I'm going to be answering a question, and the question is, how do I find out if my thyroid is, if my Hashimoto's is active? Okay, so so there are different forms. Apparently, whoever asked this question was either reading about the different types of autoimmunity with Hashimoto's. And there are three different types. One would be silent. There's silent Hashimoto's. You wouldn't know you have it. It certainly wouldn't be active because it's silent. And silent means that you have the antibodies. So maybe you have a genetic background of people having autoimmunity, specifically thyroid. And along the way, life has beat you up a little bit. Triggers, maybe surgeries, maybe accidents, stresses, viral infections, whatever. All of these triggers can set off an immune response. But it may be that your physiology is pretty good. You develop some antibodies to your thyroid, but your physiology is in such a fairly good condition at that point in time that you're just not getting any symptoms. So you're not getting any symptoms. You wouldn't know you have it. It's inactive. It's silent. Okay, and you would have positive antibodies if somebody tested them as part of a full thyroid panel, which most people don't do full thyroid panels. But if they did, they could come up with antibodies to say you have Hashimoto's. And you say, what? How would that be? I have like no symptoms of it. Like I'm not overweight. My hair's not falling out. I'm not getting heart palpitations. I'm not fatigued. That's silent autoimmunity, silent Hashimoto's. Then is when it starts getting active. The second stage, as we call it, is reactive. Reactive Hashimoto's, reactive autoimmunity, actually, but it specifically, if the thyroid is being attacked, it's reactive Hashimoto's. And basically what happens is you're getting all the symptoms, but you go to the doctor and they either don't run the antibodies and all your other labs are normal, or they run the antibodies and it may be on a day where your antibodies are down, even though you're not feeling good, because antibodies go up and down relative to a zillion different things, or at least 39 different things. And so the antibodies could be down that day, or you could go to a lab that uses ranges that are too wide, as far as the range that we use is 0 to 9 for thyroid antibodies. A lot of labs are still using 0 to 34. Some are using 0 to 20. I called somebody in Alabama not long ago, and there's a hospital down there still using 0 to 100. So you might have all the symptoms. They might tell you that you're normal, and we would call that reactive hypoglycemia, reactive Hashimoto's thyroiditis. So, and then there's full blown. You have all the symptoms. And then the lab tests are positive. You've got the antibodies. They've been diagnosed correctly, and so now the medical community will be willing to do something about your Hashimoto's once you've reached full blown autoimmunity. In this particular case, Hashimoto's. So within that framework, within that context, you may have picked up that it's really more about the symptoms. So if it's silent, you don't have any symptoms, and you're certainly not active. If it's active, you're going to be experiencing physical symptoms and or the physiological symptoms. So physical symptoms would be, physical symptoms could be, you touch your thyroid and it's tender. That would be like the most prominent one. The most prominent one that I hear is my thyroid swells up, it goes down. There are days that it gets really big. I'm developing a goiter. these are what would be physical symptoms that you're in an active stage of Hashimoto's. But it would be mainly the hyper symptoms that let you know that you're in an active response. And the hyper symptoms are anxiety for no reason at all, more heart palpitations for no reason at all, inward tremors, night sweats, insomnia. These things, have become more, the insomnia has become more, suddenly you have night sweats, or your night sweats have become more. The number one that I usually look for is I'm getting heart palpitations, I'm getting anxiety intermittently for no reason at all. And then you combine that with the fact that the person has positive antibodies, and you combine that with the fact that the person, you do an exam, and you might start to find that they have exam findings of tenderness around the thyroid, and that maybe they're having poor blood flow to their extremities. There's a number of exam findings that the doctor should be able to pick up, but it's mostly about the symptoms. You have those symptoms, there's a good chance you're in an active case. You have those symptoms, and you reach up here, and you put your finger right on that little Adam's apple, and you feel right on both sides of it, above and below it. It's tender. You're in an active case. So that's how you would figure it out.